And I think that we will move along. And Cassian, I'll just make sure that our next presenter is all set and ready. We got to see a thumbs up. So here's Courtney. Courtney, would you like to join me today?
Hi, Christine. Thank you so much for having me today.
Well, thank you so much for making time today. I
Yeah,
appreciate it.
yeah, of course.
I'm just going to do a little introduction if you don't mind.
Absolutely. Go
So
ahead.
I'd like to introduce Courtney Mall. And oh, Courtney, I hope I pronounced your last name correctly. Please correct me. Is it Mall?
Yep, it's Mall. Yeah, you
Okay,
got it.
thank you.
Yeah.
Sorry.
No, it's all good.
Um, Courtney is a registered nurse and she's at the Ottawa Hospital. She has six years experience with inpatient urology, oncology, surgical care. Currently in her role as acting clinical care leader, Courtney oversees the day-to-day coordination of care provided to patients admitted to Seven West at the general campus. I think I heard something about Seven West at that conference we attended, Courtney. And in previous role at bedside nurse on Seven West, she gained extensive experience with hands-on care and education to patients and their loved ones, their caregivers affected by kidney cancer. So she is very well qualified to inform you on post-operative care, and I think you're going to share lots of important information because we get tons of questions all the time, and we really don't have the answers. So I'm glad that you're here to help us and provide the information we need. So I'll let you take it away.
That's great. Thank you. I'm just going to share my screen. I just kind of have some simple slides to keep us on task. Let me know if you can see that.
I can see it fine. Yes, thank you.
Okay, wonderful. So, hi everyone. Good afternoon. My name is Courtney. Thank you for Christine for having me today. I'm here to talk to you today about what patients and their caregivers may expect when they come to hospital for their total or partial nephrectomy. I'll be going over the different phases of care you may go through during your admission for surgery. I'm going to talk to you how to prepare yourself for surgery, what to expect on the day of your surgery, and what your recovery in hospital might look like, and how you can take care of yourself at home once you are discharged. I know this may be an uncertain time for you, so I'm going to do my best to provide clear, concise information that may help you with what's to come. So that's that there. So, a bit about me. I'm a registered nurse at the Ottawa Hospital, like Christine said. I have 6 years of bedside nursing experience. My unit specializes in a diverse array of surgical services, one being urology. As an inpatient unit, we see patients after they have had their surgery and have recovered from their anesthesia and care for them until they are ready for discharge. In my position as clinical care leader, I work alongside incredible nurses, healthcare aides, and members of the allied health team, making sure that all the staff are supported so they may deliver the best care possible to our patients. I also work closely with resident and staff urologists who are consistently demonstrating a high quality of care and compassion for our patients. They are extremely knowledgeable and work very hard to develop trusting relationships with their patients and their loved ones. So, I'm going to take you on a journey for what you might expect during your hospital stay for your nephrectomy. I've pulled information from national and provincial resources as well as from my hospital. So, I will keep it as general as possible for you all today, as different hospitals may have different processes. And I'm also going to share a few things I've learned in my time as a bedside nurse. I do not have experience personally in the pre admission area or recovery area. However, I have gathered information from my colleagues to share with you today. So, this is our timeline. You and your surgeon have decided that surgery is right for you. You may be scheduled for an appointment to be seen prior to surgery, several days or weeks before your surgery. It may be in person at the hospital or virtually over the phone or video. This appointment is intended to learn more about you and your health in preparation for your surgery. They may ask you questions about your past medical history and or any prescriptions that you may take, whether prescribed or over the counter. They want to know everything. They will also ask you about your lifestyle habits, such as current activity levels, if you smoke and or if you drink alcohol. There are things that you can do to prepare your body for surgery, By doing so, you can help promote improved healing after surgery. It is recommended that you increase or maintain your activity levels. If you are able, slowly increase your activity as tolerated. For example, walk for longer periods, stretch, practice your balance, and mobility exercises. It can also be beneficial to practice deep breathing, as this will be a useful skill in your recovery. After surgery, you may feel tired, so promoting strength prior to your surgery can help you recover faster. It's recommended that you stop smoking before surgery. You may be putting yourself at risk for infection or breathing complications. At a minimum, you should not smoke on the day of your surgery. It is recommended that you stop drinking alcohol at least 4 weeks before your surgery. Even if you are unable to stop drinking alcohol completely, reducing the amount of alcohol you drink in the 4 weeks before surgery will be helpful for your recovery. It's important that your doctors know about your alcohol intake to be able to monitor for alcohol withdrawal, as this can be dangerous if gone unnoticed. Okay, so now it's a few days before your surgery. Your surgeon may provide you with specific instructions in the few days prior to your surgery regarding your medications. It's usually recommended to stop taking anti-inflammatories, these as Advil, Motrin, Aleve, etc., prior to your surgery. If you are on blood thinners, your surgeon may ask you to stop taking these a few days prior to your surgery. They may also have specific instructions if you take blood pressure medications. Tylenol is generally okay, unless otherwise indicated. Okay, now it is the day before your surgery. Your surgeon will advise you how to prepare yourself for surgery with regards to fasting. Some surgeons may ask that you do not have anything by mouth after midnight the night before your surgery. Some surgeons may suggest to drink colorless clear fluids, such as apple juice, up until a few hours before your surgery. Regardless of the instruction, one thing remains the same. Stop eating food at midnight before your surgery. Packing your bag. If you need it, bring your glasses, hearing aids, dentures, and any other aids that you need. Make sure that you bring it in labeled containers because you will need to remove them for your surgery. If you are a CPAP user, please bring this as well. Other than inhalers, insulin, and any special medications, please do not bring your medications to the hospital unless otherwise instructed by your surgeon. The hospital should provide you with your medications while you are admitted unless otherwise instructed. Keep all other valuables at home. If you must bring your cell phone, please label it. It's recommended to leave this at home and ask a loved one to bring it in once you're settled in your room. Okay, now it is the day of your surgery. We're finally here. So it's the morning of your surgery. I'm going to give you some hygiene tips for how to prepare your body for your procedure before setting off for the hospital. Clean yourself thoroughly in the shower. If you do not have time in the morning of your surgery, the night before will do as well, but it's recommended the day of. If you're having laparoscopic surgery, make sure that your belly button is clean because they may go through there. Do not apply any lotions or potions to your skin after your shower. You may be asked to clean your skin with a special skin cleanser to reduce your risk of infection. If you have not been asked to do this, no worries. Your surgeon will also disinfect your skin prior to surgery. Make sure you brush your teeth very well and rinse afterwards to help you reduce your risk of infection from the breathing tube. Please remove all nail polish, all body piercing and jewelry and makeup. Acrylic nails and dark nail polish can make it difficult for our oxygen probes to read your levels properly. Okay, now it is time to go to the hospital and get checked in. You should have been provided instructions for where to check in already. Make sure you bring your health card, and if you have any supplemental insurance, make sure you bring that. If you have private or semi-private coverage, we'll do our best to accommodate you. However, it is unfortunately not guaranteed, but we will try. When you arrive at the hospital, you will be taken to the preoperative area to prepare for surgery. Your surgeon will go through any questions you have prior to your surgery. You will be assessed to determine if you are in good condition to proceed. You will then be taken into the operating room, and the surgeons and nurses will perform their checks and ensure that you are safe to proceed and ensure that they are safe to proceed as well. The anesthesiologist will discuss with you if you require an epidural before surgery. When you are ready, they will give you some medication to help you sleep and keep you comfortable during your surgery. After the surgery is done, the doctors and nurses will wake you up when it is safe to do so, and you will be taken to the recovery area. This is referred to the post anesthesia care unit, or PACU, or PACU. In PACU, you will be under the care of specially trained nurses to help recover from your anesthesia and keep your pain under control. They will watch you closely immediately after surgery and monitor your vitals. These are things like your blood pressure, your heart rate, your oxygen. Those are to ensure that you are recovering well. At this time, you may be sleepy and you might be disoriented, but your nurses will reassure you that you are safe. You may find that there are wires, tubes, and pumps attached to you. It is important that you do not touch anything, any of the tubes or wires that are connected to you. If something doesn't feel quite right, let your nurse know right away. This goes for your entire hospital stay. There may be tubing in your nose or a mask over your mouth and nose to deliver oxygen. You may have one or more intravenous in your arms to deliver medications and fluids. You may have a pain pump. If you have a pain pump, your nurse will teach you how to use it appropriately when you are more awake. The pain pump may be intravenous or may be in an epidural in your spine. If you have had a laparoscopic nephrectomy, you may find a few small wound dressings on your abdomen. If you have had an open nephrectomy, you will find a larger wound dressing on your abdomen. Immediately after surgery, your nurse will be monitoring these frequently to assess for any bleeding or other concerns. You may have a Foley catheter after surgery. This is a small tube inserted into your bladder through your urethra to monitor urine output after surgery. Your nurses and doctors will be able to keep a watchful eye on your urine and will be able to tell if something is wrong. You may also have a drain in your abdomen. This may be to help the surgical area heal better and or to monitor for any complications. On your legs, you may have leg warmers that squeeze and release to help with blood flow while you are resting in bed. These are called sequential compression devices, or SCDs. These are to prevent deep vein thrombus, or DVT, aka clots. You are at higher risk of developing a DVT after surgery because you are not moving as you normally would. Depending on your hospital, there may be no visitors allowed in the recovery area. This is so that the staff can completely focus on you. Your surgeon will call your next of kin after surgery to let them know how things went. If your surgeon wants to monitor you overnight or a few days, you will be moved to another unit where you will be assigned a bed. This is when you would come to me. When you are safe and stable to leave the recovery area, your nurse who is attending to you there will call your new nurse on the inpatient unit and give report. When you get to your new unit, you may be helped into your new bed in one of two ways. Your nurse may use a board to slide you from your stretcher to your bed, or if you have enough energy and your pain is well controlled, your nurse can help you stand from the stretcher and help you take a few steps to your new bed. Your new nurse will assess you, ask lots of questions, and make you comfortable so you have time to rest. It is likely that on your first night, you will be woken up in the night so the nurse can check your tubes and incisions, check your vitals, and give you medications to keep your pain under control. It is expected that you will have some degree of pain after surgery. Our goal is to keep your pain controlled to a level where you are still able to move. If the pain is preventing you from moving, let your nurse know so that they can make a pain management plan with you. If you have been given a pain pump, your nurse will check that it is in working order and make sure that you know how to use it appropriately. If the pain pump is intravenous, you will be given a button that you can press when you are having pain. This is especially useful when getting in and out of bed. The pain pumps are usually only for short-term use for about 24 to 48 hours after surgery. If you have an epidural, your nurse will check if you are numb in any areas. They do this with ice to see if you can feel it. They will also check that you can move your arms and legs well, and you do not have any side effects from your epidural. You may also be given oral pills to control your pain. Usually, Tylenol is given regularly the first few days after surgery to control your pain. In addition, you may also be given oral narcotics if you do not have a pain pump or if you no longer require a pain pump. For an intravenous, you will likely have hydration or possibly medications infusing through your intravenous after surgery. Your doctor will stop your IV fluids when you are drinking well. Your IV may stay in your arm until you are close to being discharged. Even if it's not being used, it will may be kept in place in case of an emergency. It's important to be careful when adjusting yourself in bed or getting in and out of bed to make sure that you do not pull on the tubing as it can fall out. If it falls out, no worries, it happens. Just let your nurse know and they can place a new one if you need it. In terms of your bladder, your Foley catheter will stay in place until your surgeon says it's ready to be removed. Your nurse will remove your Foley catheter. Usually, after your catheter is removed, your nurse will monitor to make sure you are able to pee properly. They may want to measure how much you are peeing, and so that they can keep an eye out for any blood in your urine. After you use the bathroom, they may use a small ultrasound machine on your lower belly to check if there's any urine left over in your bladder after you've gone to the bathroom. In terms of your bowels, your doctors and nurses will likely ask you a few times if you have passed gas. This is generally an indicator that your bowels are working. If you have had laparoscopic surgery, the surgeon inserts air into your abdomen during surgery so that they can see the surgical site better. After surgery, it can cause some discomfort because you might feel quite bloated. Walking is very important to help move this air out of your belly, and chewing gum can also help. It is possible that you could become constipated after surgery due to the use of narcotics, a type of pain medication. Once you are reliably passing gas, we may give you stool softeners to help draw water into your stools to help them pass more easily. It's very important to avoid straining when having a bowel movement, as this can cause pressure in your abdomen and could possibly cause injury to your surgical site. You are not necessarily expected to have a bowel movement before you are discharged, but if you are at home and you have not had a bowel movement within 5 days after surgery, you should notify your doctor. If you are not passing gas or having bowel movements and are having nausea and vomiting that will not go away, this can be a sign that your bowels are not working well. And if you're at home, you should come to the hospital. In terms of mobility, on your first day after surgery, we usually expect that you will sit in a chair for your meals and we'll help you walk a few times. You may still feel tired and may need some help, and that's okay. That's what we're here for. In terms of your diet, you may not feel very hungry, and that's okay. Take small bites and eat slowly. Make sure that you prioritize drinking lots of fluids. Sometimes the medications from surgery and pain medications can make patients feel nauseous. Let your nurse know if you're feeling nauseous, and they may be able to offer you something to help. So there are some things that you can do to help prevent complications from your surgery. Ankle exercises are quite important. If you do not have the leg squeezing machine on anymore, like in recovery, and you're still spending most of your time in bed, you should perform ankle exercises 10 times every hour while awake. Point and flex your toes to engage your calf muscles and circle your ankles clockwise and counterclockwise. This is to help prevent blood clots in your legs. Your surgeon may also prescribe you with a blood thinner that your nurse will inject with a small needle under the skin in your belly once or twice a day while you're in hospital to reduce your risk of clots even further. After surgery, we tend to take smaller breaths. This can be because of pain, medications given during your surgery, or because you're not as active as you normally would be. Doing deep breathing and coughing exercises will help to keep your lungs healthy by getting rid of extra secretions. You can do so by taking a small pillow or a folded blanket and holding it over your belly. Take a deep breath in through your nose, hold it for 5 seconds, and breathe out through your mouth. After the first 5 deep breaths, we usually want you to cough as well to help expel any secretions that might be loose. That's when the blanket or pillow will be beneficial because you can help to squeeze it over your belly to protect your surgical area. Sometimes a coughing can cause a bit of situational pain, but it should subside quickly and the pain should get less every time you do it. Getting in and out of bed safely is also something that's important to consider. When you are admitted to the unit, you will be given a call bell so that you can call your nurse for help. Do not get out of bed on your own for the first time after surgery. When it is time to get up out of bed after surgery for the first time, your nurse will help you. They will show you how to safely get in and out of bed while protecting your surgical incisions, preventing pain, and keeping your lines and drains in place. When moving around, it's important to avoid using your abdominal muscles as much as possible to prevent your incisions from being harmed and to prevent pain. To go from lying down to sitting, you can roll onto your side and push yourself up to sit, but your nurse should be able to show you hands-on how to do it safely. And if you can't do it on your own, that's what we're here for to help. It's important to take it slow because sometimes going from lying down to sitting and sitting to standing can cause dizziness, which is normal, but if it doesn't subside after a few minutes, we'll help you lie back down and make sure that there's nothing else going on. So your surgeon will know when it's time for you to head home when you have met the following discharge milestones. You are mobilizing well back at your baseline. So if you had been using a walker before your surgery, we don't expect you to be able to walk without your walker anymore. We want you to be able to get to your baseline mobility. Your pain is well controlled on oral medications. You are tolerating food and liquids. You are passing gas, and you are able to urinate. It may be possible that you are discharged with the urinary catheter in place, but your surgeon will tell you if that is the case, and your nurse will teach you how to take care of it properly at home. Discharge instructions, they're fairly standard for most patients, but I'm going to just kind of be more specific with nephrectomies with some of these things as well. In general, emergency warning signs. Call your doctor right away or go to the emergency department if you have any of these warning signs. A hard time breathing, pain in your chest, new swelling, or pain in your legs or calves. This is usually a sign that maybe a clot has traveled somewhere in your body and you should come and get that checked out right away. If you have a fever over 38 degrees for more than 24 hours, this could indicate that there's an infection going on possibly. A lot of pain, new pain, swelling, redness, or bleeding from your wound. Your wound opens up. Your wound has an increase in or change of color of oozing that won't go away. You throw up or feel sick to your stomach and it won't go away after 24 hours. And if you have lots of blood in your urine and or passing clots in your urine. For wound care, showering is okay. Avoid soaking your incision. So no bathing, swimming, hot tubs, or saunas, generally for 4 to 6 weeks, or as your surgeon tells you. Wash your incision with mild soap and water daily, rinse well, and pat dry. If you have steri strips, like small little tapes on your incision, usually we'll ask you to let them fall off after 7 to 10 days after your surgery. If they have not fallen off by 10 days, you can remove them in the shower, usually with soap and warm water. If you have staples, your nurse or doctor will provide you with a staple remover to bring it to your family doctor or walk-in clinic for removal, usually around 10 to 14 days after surgery. This one is more in particular to open nephrectomies. A very small amount of pink-colored oozing is normal a few days after surgery. It should get less with each day. Monitor your wound for redness, pus, swelling, and bleeding from the incision. If you notice a change in your incision, see your family doctor, call the surgeon's office, or if you are really concerned, come to the emergency department. Pain control. Avoid anti-inflammatories, so NSAIDs, Advil, Aleve, Motrin, ibuprofen, Celebrex. We touched on this a bit earlier, but it comes back again. They can impair your kidney function, so it's really important that you stay away from these. To control your pain, you will be able to take Tylenol, regular strength or extra strength, regularly after around the first 24 to 48 hours after surgery. And you can take it less and less frequently as your pain improves. You should never exceed more than 4 grams of Tylenol in a 24-hour period. If your pain is still not controlled well with the Tylenol, you may be given a prescription for narcotics. These are to be taken sparingly and at the lowest dose possible to manage your pain. Side effects of narcotics are drowsiness, dizziness, and most notably, constipation. You may be prescribed with stool softeners after surgery. You may be instructed to take these until your bowel movements return to normal. Your surgeon will advise you when it is appropriate to restart your blood thinners and or blood pressure medications. You may resume your normal diet unless otherwise instructed, and drink enough fluids to keep your urine clear or pale yellow. Usually 1 to 2 liters is recommended unless you are on a fluid restrictive diet, in which case your surgeon will tell you. Activity and restrictions. It's strongly recommended that someone stays with you the first night to the first few nights after you are home, just in case anything happens. No heavy lifting for 4 to 6 weeks. This includes pushing or pulling, so avoid shoveling snow or mowing the lawn, as this can cause stress to your surgical area. Especially important right now because it is snowing right now. Walking or light jogging is encouraged within the limits of your pain tolerance, and gradually resume normal physical activities as tolerated. For driving, do not drive while you are taking narcotics and you have not been taking narcotics for 24 hours. When you know it's safe for you to be able to drive, practice slamming the brakes in your parked car. If it elicits a lot of pain, you're not ready to drive. If you are able to slam the brakes and your pain is still well controlled, you should be okay to drive as long as you're not taking narcotics. For your follow-up, usually your surgeon will recommend that you follow up with your family physician if there have been any changes in your home medications. Follow up with your surgeon in a few weeks. They will usually call you for an appointment, date and time. During this appointment, they should have your pathology results back and will review those with you at that time. There's also a good resource over the phone or online, telehealth, for general information. If it's specific to you and your surgery, they might not be able to help you, but they're better for more general information. And if you have questions about your medication, your pharmacist can be a really good resource for that as well. Okay, so that concludes things for me for my presentation. I'm happy to take any questions if anyone has any, and I hope that this was helpful and insightful, and thank you all for listening.
Sorry, that was great, Courtney. Thank you. I have questions myself, and
Of course.
I see you're getting thumbs up and hearts. I encourage anybody that has a question from our attendees to please type it in the question and answer or the chat. It's at the bottom of your screen, and we'll certainly address it. But you brought up so many good points. I have to get my notes out. Number one of the things that you brought up was, preparing for surgery and the deep breathing and, increasing your activity and eating well. And we're going to have a talk in a little bit about a program. It's called Cancer Pep, and it's a daily program that it does follow that routine. And it's usually for, patients that are in recovery or after, but I think it might fit well leading into surgery if you have a diagnosis and you're going to, because it really gives you ideas and information on how to prepare for your surgery. And you gave a lot of good points. One that I have a question about is when you've had your surgery, and obviously, your abdominal area is very sensitive and tender. And do you have tips of how to properly get out of bed? And I've also heard about using a lazy boy instead of laying down in bed. Can you comment on that?
Yeah, actually, I didn't go over it in too much detail because I was kind of running out of time, but Getting in and out of bed after surgery, if you're in the hospital bed, you can use the buttons on the side to raise and lower your head of your bed, and also the
Mm-hmm.
railings on the side of your bed can be helpful. But when you're at home, you might not have that.
Mm-hmm.
So we suggest that, for example, if you've had your nephrectomy on your right side,
Mm-hmm.
getting out of bed on your left side so that you're not rolling over onto your incision, you're rolling away from your incision.
Mm-hmm.
If you roll over onto your side and then you scoot your legs to the edge of the bed and then you use your arms to push you up so that you're sitting on the edge of the bed, by
Mm-hmm.
doing so, you are using your abdominal muscles as little as possible and
Mm-hmm.
you're engaging your arms and legs to help you as much as possible. I hope
Okay.
that is helpful.
It is helpful. Same for, okay, say you're sitting in your chair. Like, is there any truth, like, to you hold a pillow on your tummy when you're trying to get up, or, does that help?
Yeah, it can help. We call it splinting. So sometimes if you hold a small pillow or a folded blanket over your abdomen, it can help to like provide a bit of a brace to your surgical area so that you're
Mm-hmm.
not having to use your abdominal muscles as much. It's
Okay.
more beneficial if you're like when I talked about doing your coughing exercises because or if you feel a sneeze coming on, you can grab your pillow and just kind of hug it to your belly to provide
Mm-hmm.
a little bit of additional support.
Mm-hmm.
It can also be helpful when you're standing up as well.
Oh,
But the
okay.
coughing and the sneezing, when it's kind of like a situational increase in pressure, that can
Yeah.
be when it's the most beneficial.
Yeah, that's a great idea.
Hmm.
Um, we have some patients that don't pay attention. What is the standard usually? Like, is it true like 6 weeks about lifting, and that kind of activity that would strain your abdominal core? Is that something people should follow?
Absolutely. It's super important that you even if you were like fully functional before surgery and
Mm-hmm.
you feel fully functional after surgery, pretend that you're not because it could be that, if you do things that you shouldn't be doing because you feel like you can, you could be
Mm-hmm.
actually damaging things inside. And if you have small incisions in your abdomen, it's on the outside, it might not look like there's a lot going on, but there is a lot of stuff that happens underneath that we don't see. So
Mm-hmm.
just being extra careful and extra cautious in the few weeks after surgery can just make sure that you're not going to have any complications. For example, if you feel really good and I'm going to go take out the trash, but it's super heavy, but I feel good, it might
Yeah.
cause some problems.
Yeah. We've had a few patients that have ended up with hernias and that's
Exactly.
something you do not want to
No.
have after abdominal surgery because sometimes it means more.
Yeah. And
So,
I've
well,
also
thank you.
seen with partial nephrectomies, they because there are risk of bleeding after surgery,
Yeah.
things might have been healing well and they were just a little bit too brave with some things and they had to come back because they're,
Oh,
started bleeding again. But,
yeah.
it happens and
It,
even it might happen that sometimes these complications do occur and you were being super, super careful.
yeah.
Sometimes it just happens too.
Yeah. So it's a good thing to be aware,
Hmm.
um, and um, and be cautious. I think
That's right.
those are the two key things. Are there any foods? We get a lot of questions about eating different foods going into surgery, and I know you said just good nutrition, but is there anything that you recommend to your patients, or um,
Well, like I had mentioned earlier, I'm not
yeah,
familiar with like the preoperative phase of
yeah,
care generally, but one thing that does come up often is then the day before your surgery, eating a high protein snack or meal
oh,
in the evening might be helpful with energy levels the next day because you're fasting for
okay,
most of your surgical day.
that's a great point. Okay,
Yeah.
thank you.
So that could be helpful. But in terms of like leading up to surgery, the few weeks or months before your surgery,
Hmm.
um, just making sure that it might be helpful to try to eat foods in high fiber if you're able to tolerate it, just to have a bowel routine so that you know
Mm-hmm.
after surgery what your bowel routine looks like. So you know when
Mm-hmm.
you get like should get concerned. Because if you're normally like an every day to the bathroom type of person,
Mm-hmm.
and after surgery you haven't gone in quite a number of
Mm-hmm.
days, that could be different than someone who goes every 3 days maybe, and that's their usual. So
Mm-hmm.
it's kind of knowing what your body routines are like could be helpful.
So, so that's good points. Pay attention to your body routine
Hmm.
before you go into surgery so you don't get scared after surgery when it may be a little bit different. But
Yeah.
still pay attention to the warning signs
Hmm.
that you gave. And
Yeah.
I was surprised with your driving instructions.
Yeah.
Because we always get questions like, when can I drive? And it's like, 3 days later sort of thing. But it
Yeah.
was a really good point. So there's no rule of thumb necessarily.
Hmm.
It's just when you feel comfortable and can manage working the brake quickly.
Exactly. And sometimes you might be surprised, again, kind of going back to the I think I can do it, and then you do it and you say, maybe I'm not quite ready yet.
Yeah,
Yeah.
yeah. Um, I think those are the key items. I'm so glad that we have your slides after because somebody that's just actually going into surgery, and actually it may be myself, that I'm going to pay attention to all this valuable information that you provided. That we're going to have them living on our website so that somebody that comes along, and maybe next year that's going to face surgery will be able to check and see what to expect. So this is
Mhm.
really valuable information for us and our patient community. I can't thank you enough
Yeah.
for stopping with us and sharing the day and providing this valuable information. Thank you very much.
Thank you, Christine.
Okay, we'll see you again.
See you later.